We're a union that represents healthcare workers, particularly doctors, throughout the country. And when I speak today, I don't speak on an individual basis, but representing a number of healthcare workers in the public healthcare industry. It is quite concerning that, unfortunately, health has had the budget taken down, particularly taking into account that we strongly do believe that health is a basic human right and not necessarily a privilege that should only be afforded to some who maybe are more privileged financially. Health is really the crux and the backbone of our entire country.
Yeah.
And without a community or even a society that is healthy, one able to also fully have the strong economic growth that we want for the country. So for us, one of the main things we really want is the optimization and the improvement of the healthcare resource element. So it was previously stated that 800 posts would be opened up according to the budget speech 1.0. And we're hoping that is what will continue to happen with this new set budget. We're also hoping that other healthcare workers, as you know, we work in teams and not only doctors alone. We work together with nurses, allied workers, pharmacists, in order to give the best healthcare we can to the communities. Also taking into account the fact that more than 80% of our country depends on these institutions in which our members are currently working. And in order to give them the best that they want, or the best that they need in particular, the human resource element or pillar in the healthcare sector is fundamental. So we really hope that this is also able to happen. We know as a follow-up after the budget speech, there was also a press statement that was given forth by the Minister of Health. And I think one of the things that was put across is that there will be more than 1,000 posts prioritized for doctors, which we also hope this budget will be allowed to account for. We also, as I said, wanting for other healthcare workers to also have more posts opened up and for it to happen as soon as possible. We have healthcare workers that are currently sitting at home unemployed and really would love to be part of the system, taking into account the current shortage we currently have.
Yeah, and in fact, as you say that, pardon the interruption, we know that the budget will be increased by 20.8 billion rand over 3 years to employ 800 post-community service doctors and essential goods and services, and the reduction of accruals. Looking at that, do you feel that it was there was enough detail on the broader structural issues within the health system and how those will be addressed as we learn of the plan looking ahead over the next 3 years?
Enough detail given, but we're also hoping we'll be able to assist in that regard, because 800 posts is well accepted for this financial year for the gap. It's not enough. The dynamics that we're currently having, the changes we might have in the population, the human resource elements that may happen, it needs to be an ongoing process. Infrastructure development, we also need to speak about monitoring and evaluation and also improving the current infrastructure that also exists. So welcoming changes, I think one of the hospitals that was highlighted was Siloam Hospital in Limpopo. We do agree and we do welcome the infrastructure development there, but we're also saying let's also look at other institutes. But as much as health is the backbone and health is a basic human right, it's also important not to only see it in a silo. And when we look at it, it needs to be integrated into the primary sectors, all the districts. Also thinking as to going forward into the NHI, how is it that we're going to ensure that the healthcare institutions are easily accessible? Are the roads also going to be well developed to get to people? Those are just a few things. But what I'm saying is it should be an ongoing process and not necessarily stagnant. As much as there's a 3-year plan, we need to continue looking at things.
What about the so-called elephant in the room? The minister having mentioned that there was some long-standing spending pressures, one of them being the gap left by the withdrawal of the US president's emergency plan for AIDS relief.
I think that's a very important point you put forward. There are some services that have definitely been affected by the fact that we have lost aid from the US. This is a moment for us as South Africa to truly reflect and realize we need to find ourselves and move towards a situation in which we are fully efficient in every single element and every single area of the supply chain of health. This is the moment where we realize job creation can also happen in the healthcare sector. The solutions we need in healthcare, we need to use the brains as well as the labor force in this country in order to, for pharmaceuticals, it's time for particular licenses to be given for manufacturing in South Africa itself, in order for us to have important medications such as heart or TB treatment as well as malaria treatment that we are using here to be supplied here, but also manufactured here for our community. That in itself will also allow for economic development. It will allow for research and skills to come and be for ourselves here in this country. And it's important, and we hope the health department is able to close those gaps as soon as possible, because the healthcare services that were given to us were important. And every aspect of health is important. And as we said from the very beginning, as a union, we stand strongly by the fact that health is a basic human right which should be afforded to every single South African, irrespective of where they are and what the economic standing is. Because a country that is healthy is also able to grow economically and go from strength to strength.
Absolutely. Thank you so much for joining us. Wrapping that discussion by SAMATU Deputy President Dr. Nkateko Mnisi.